so we're talking about children's dental health, and we're not just talking about the young kids. Teenagers need to look out for it too, Doug.
Well, yeah, you know, we've been talking a lot about adults here, and then we've also talked about the real young ones like you're getting ready to have.
Yeah,
and so we're going to kind of go in between. We're going to talk about older children and maybe teenagers.
Okay.
First thing, I think the most important thing is sealants. You know, at 6 years old, your child will get 4 adult molars in, and then at 12 years old, the same thing. They will get 4 adult molars in. Really, really important to get sealants in those. Sealants are just a little resin we flow in the grooves of the chewing surfaces where most cavities occur. It's quick, painless. We don't have to even numb them up, and it doesn't take any time at all, and it's huge for preventing future cavities.
Yeah, and at that age, that's probably the age where you're going to consume the most amount of sugar.
That's exactly right. That's a great point. Yeah, kids love sugar, a lot of sugar, sugary drinks and everything, and so really, really important with those adult molars to protect them, and just goes a long way, really, for all of life. I mean, I'll see adults, you know, older than me that still have sealants in their teeth. So. All
right, mouth guards, something else that kids can use in this growing up teenage years.
Right. You know, a lot of times, you know, us when we grew up, and I was, you know, I went to you know, Walmart and got a $2 rubber mouthpiece, boiled it for a while, and you put it in your mouth.
Bite down on it, it conforms.
They have their function, they're good, but you know, really, if your child is going to be really active in a lot of sports, especially contact sports, football, and really, you know, soccer too, basketball. Getting a custom-made mouth guard, you know, a custom-made mouth guard will last you a long time, and they go to work a lot better on kind of protecting those teeth in those combat sports.
All right, and again, at this age, this is probably the most common thing that we see on teenagers' teeth, braces.
Yeah, braces, you know, it's funny because when people think braces, they think, oh, just to make the teeth pretty, to make a pretty smile. Really, braces are a lot more than that. You know, braces not only shape the teeth, they also shape the bones of the face. And so it oftentimes can lead to more healthy mouth in the long run. If you have straight teeth, they're easier to clean. And when you get the bite straight, too, it can be important for the health of the joint.
So obviously, all good points for helping teens have better dental health. And that's something, again, we keep talking about it each time you come in. Dentistry is something that we can so easily forget about.
Well, it is kind of overlooked, especially if you're not in any pain. And a lot of times things can be wrong in there without you having any pain. And this is kind of an age, again, where you're real busy with the kids, and sometimes you can kind of get, you know, overlooked every 6 months. But it's just really, really important to take care of all these things. Really, really help them out, not only when they're teenage years, but on through the rest of life.